It is a beautiful day. Good morning. Thank you all for coming. Welcome to Rowan College of Burlington County. My name is Mike Ciosi. I serve as the president here at RCBC. RCBC has been in a unique position over these last 7 months. We've been a leader in assisting the county's effort to curb COVID-19, from our nursing students volunteering at the testing sites that have popped up, call bank centers, to the donation of some of the PPE that RCBC had in supply early on, and including some of the return to campus that RCBC started and safely since the summer semester. Our return to campus has been working well for the fall of 2020, and we're prepared to have even more activity in the coming weeks with an eye on the spring semester that begins in January. We're excited to extend our partnership with Burlington County and offer space on our campus here in Mount Laurel for the testing site that will provide central access to all county residents, including our students here at RCBC, faculty and staff, who have asked us about the possibility of on-site testing. My hope is that we will not need this site for that long, and that hopefully, through the hard work that the county has already demonstrated and achieved, that we can get past this pandemic and have this parking lot filled with students pretty soon. It is now my honor to introduce a friend of the college and liaison to the health department, freeholder Dan O'Connor.
Good morning, everybody, and thank you for joining us today. I apologize for a little raspy voice. I think it's allergy season. And thank you, Dr. Ciosi, for welcoming us here today for this important announcement and for working with our health department to bring our new COVID-19 test clinic to this campus. Rowan College at Burlington County has always been an institution everyone in the county can be proud of because of the outstanding and affordable education you deliver to our students and workforce. But I think we've all come to appreciate the college even more during this difficult period of pandemic and economic upheaval. Last March, when the coronavirus outbreak began, most colleges had to shut down and then took weeks or months to adjust. But RCBC succeeded in moving all its classes and programs to an online virtual environment within a matter of days. The college's fast response helped keep students and staff safe and allowed them to continue their courses and stay on track to complete their degrees. This fall, you've managed to reopen and welcome students and staff back to a safe campus environment while continuing to offer a large menu of online courses. Your success has been a shining light during this dark period and positioned our county's college to be a top choice for students seeking a safer, more affordable education at home. You're also helping the many unemployed adults whose lives were upended by the pandemic learn new skills needed for virus-proof employment. We applaud RCBC for successfully carrying out such an important mission. We also thank the college administration, Board of Trustees, and community at large for being such outstanding partners as our county government continues to do everything within our power to assist our residents during these difficult times. From the very start of the pandemic, our county board has taken a single-minded approach and mustered all our personnel, resources, and energy towards helping Burlington County residents weather this unprecedented crisis. We were among the very first counties to launch a COVID-19 testing program because we knew it would be essential for everyone's health and safety to have easy access to testing during a time when such resources were scarce. By providing this critical service, we identified people with infections and reduced the spread to keep more people safe. We think this expansion of our testing program today is just as important. With the help of our new testing partners, Vault Medical Services of New Jersey and the Rutgers Clinical Genomic Laboratory, we will be able to offer our residents, first responders, and frontline healthcare workers the option to undergo COVID-19 testing safely from their own homes. Dr. Conaway will explain the details of how this program works, but I can tell you that it's simple and convenient and will help expand our testing capacity at this critical time when COVID-19 activity is expected to increase. This kind of forward-thinking partnership is a hallmark of our county's response to the pandemic. Our response has extended beyond just testing. We've also distributed over 1 million pieces of PPE protective equipment to our first responders and long-term care facilities so that their workers can safely care for their vulnerable residents. We've helped thousands of food insecure families by giving them fresh produce and other groceries. And we'd like to thank our partners, the Food Bank of South Jersey and Farmers Against Hunger. And for struggling small businesses that make up the backbone of our economy, we're now offering zero-interest help loans of up to $50,000 to assist them with whatever expenses they face. We're proud of our response and even prouder that we've managed to find ways to do it without overburdening our residents. On that topic, I'd like to thank Governor Murphy and his administration. They agreed to send us more than $3 million of New Jersey CARES Act funding to help pay for our testing program and this expansion. It's partnerships like this that will allow us to continue to offer this important service and beat back the virus. I urge everyone to remain vigilant. We're beginning to see our COVID case numbers rise again. As we learned last week, anyone, even the President of the United States, can become infected if the proper protocols and guidelines are not followed by everyone. Wearing a mask in public is not a political statement or a sign of weakness. It's a common sense action that shows you take preventing the spread of this virus seriously. Now, before I'd introduce Dr. Conaway to explain how our home testing program would work, I'd like to just say a few words about the work he's done for our county. Our county board appointed Dr. Conaway to lead our health department long before anyone had ever heard of coronavirus or COVID-19. We trusted him because of his vast medical knowledge and experience. But it's become abundantly clear these last few months how lucky we all are to have him in this important post. And I want to thank him personally and on behalf of the entire board and all our health department heroes for the work they do every day to protect our residents. Thank you all again for being here today, and I'd like to introduce Dr. Conaway.
Thank you. Board member. Well, good morning. And here you are seeing just the latest example of how important it is for governments and agencies of the government to work together to deliver important services to our residents. We've got a tent behind us that was put up by our emergency management operations staff. It's spacious. It will provide a safe, covered place for people to get testing. We thank the college and President Ciosi for lending us this space so that we can bring people in for testing and so that we have a safe and reliable place for testing that will carry us through on Tuesdays and Thursdays for much of the rest of this year. And certainly we thank the administration in Trenton who listened to the 12 counties who said, you know, we need more funding, we need more help, and went to the federal government and worked to get draw down the federal funds, $3.55 million to help extend our testing program for the next 6 months. Now, this program, in contradistinction to the testing that we've done here to date, will extend to those who work in the county but who live outside of the county. So that if you are working in retail, you are working in the transportation sector, if your job requires you to be in close contact with people who are not members of your family, you work here in Burlington County, you can avail yourself of testing here in this county. It also extends to teachers who are in the same situations. They are involved with people who are not members of their family, involved with co-workers, or involved with students. Those teachers who work here but live outside of our county can also avail themselves of this testing. That's a very important note. The other important note that distinguishes this testing program from what we've done before is that we're required under federal rules to collect insurance. And this is unusual for a county-based health program. Ordinarily, our services are free, and we focus on those who lack insurance or those who have what we call lower value insurance, so that we can get vaccinations to children, so we can get health care to people who don't have ready access to health care. Under this program, however, under the federal rules again, which require all insurance companies, whether private or public, to pay for COVID testing services without any out-of-pocket cost to residents. That's an important key. We're going to collect your insurance because we're required to use the insurance if you have it, but the testing that you get here will not be at any additional cost to you. So we're going to ask you about your insurance when you arrive here on site. We're going to ask you about your insurance when you apply for eligibility for the home testing program. We do so because federal requirements demand that we do so, and you can understand this if you take a moment to think about it. We have a limited amount of money, and we want to stretch that money as far as we can, and insurers, after all, are there to pay for healthcare needs. And so we want to make sure that insurance, when it is available, that it's brought to bear to help deal with this important problem. We know that testing is helpful. The sooner we can get it to people, the more rapidly we can turn those tests around. We can get on top of those little outbreaks that we see occurring more and more as people begin to return to normalcy, which they must do. We've got to get kids back in school, we've got to get people to work, and we understand that those interactions are going to lead to people getting COVID. Now, we want people to engage safely. We will continue to encourage people to wear a mask. As Freeholder pointed out, it's not a sign of strength or weakness to wear a mask. It is a sign that you care about the person next to you. It's a sign that you care about your neighbor. It's a sign that you care about people that are not necessarily in your family, and it says that you recognize how serious this disease is, and that you're prepared to take the smallest of steps to protect yourself and to protect the public. So when you're out of your house, when you're engaged with family members you don't see every day, when you're at work, when you're shopping, when you're doing, even when you're in the park, if you happen to be on a busy trail, wear that mask. It protects not only you, but protects others, and I think that's an important part of our responsibility as citizens in a free republic such as ours. Now, let me demonstrate a little bit about the testing that we'll be using through Vault Medical Services. Whether you come here for testing or you get one of these things in the mail, the process will be the same. So let's start with the home testing program. We have a website that's established. We just went over it again this morning with staff, and I'm going to have a little show and tell here, hot off the presses. If you go to this website, you will go and answer a series of questions that will demonstrate whether or not you're eligible for testing here in Burlington County. It's going to ask about your age. It's going to ask if you live and work here. You're going to have to, if you have insurance, you're going to have to upload your insurance cards so that we can be reviewed. If you have a driver's license or other forms of ID which are identified on the website, you can upload those too. Then our staff will review that information and give you an eligibility code. You'll use that code to enter the or access the Vault Medical Services EMR, and that will result in the delivery of this test kit. So you'll get this at home. You'll peel this test kit open. There are instructions inside, and the proviso on the home test is that you have to have access to Zoom. Now you can have access personally, or if you have a friend or a family member who has access to Zoom, you get with them, you go through the process on the Vault Medical website, and a medical professional will get online with you and walk you through the process of delivering a sample to this test tube, through this funnel. You fill up the test tube with saliva to the fill line. You then take this preservative, this viral preservative, screw it, take this off, screw this on, and then it releases the preservative into the test tube. This kills the virus, but yet preserves the virus so that the genetic material there can be tested in the lab. The results of that lab test are then, you have a choice. You can get your results through the Vault Medical website, or you can give Vault Medical permission to send you a secure email for your results. The turnaround time for that test is 72 72 hours on average. On occasion, things happen. There's a misapplication of some information. It might take a day or two longer, but we can fix that for you. But we believe for those people who have difficulty accessing this site here or accessing the many mobile sites that we will have established throughout the county over the next 6 months, if you don't drive, if you're shut in, you have issues which require you to be extra careful about your contacts and exposures, this home test might be a very good way for you to understand your status. Because after all, even if you're at home, you're getting, you have people coming to your home to help you with services, to deliver services to you in your home, interactions with family members who don't live with you on a regular basis, and you're going to want to know what your status is. And this home test provides a ready means for people to understand what their status is with respect to COVID, and then thereby take appropriate actions. If you come to our sites here for the next few months on Tuesdays and Thursdays, we will be at other sites, and we'll announce a schedule on that in the coming week or so of other sites throughout the county. Those of you who have been following our actions here for some time know that we move our testing sites around to increase availability to particularly vulnerable communities. We're going to continue that process. That will be on Mondays and Wednesdays. So stay tuned for the schedule. You can use, I should have bought a sign for our Burlington County Health app, the first of its kind, and healthcare in the state, or you can go and follow our schedule. Of course, you can access our website. You'll see social media posts as well as announcements from our office about where these testing sites will be placed. Yes?
Dr. Conway, once they take the test, is it postage paid? They return it in the mail?
It's all postage paid. Sort of, so until you'll get in your packet, you'll get an envelope from UPS. You'll follow the instructions again on Zoom that tell you how to seal it up, what to put in the bag, and how to get it delivered to a mailbox where this can be gotten up to Rutgers. Now, on our mobile testing sites and our fixed testing sites, just as the one behind me, we're, again, working in partnership with the Sheriff's Office. We're going to grab those specimens and we're going to transport them ourselves right up to the Rutgers lab so that we can make sure the turnaround time on the results of that test is as small as we can make it, rather than relying on delivery. We're going to personally deliver those tests up to Rutgers so we can get those tests, those specimens tested and those results out to people as quickly as we can. I wanted, before I take some questions, I want to also alert you that last Thursday the state government has announced the launch of COVID Alert New Jersey. This is the state's effort to use technology, to leverage technology to help with contact tracing. We have unfortunately had over time people who've been resistant to this. They're concerned about being identified. Using the software that's on if you agree to it, on your Apple phone, on your Android phones, as a basis for this app, you will be able to, as you progress throughout your day, you'll send your phone will send signals to the phones of other people who have downloaded the app, COVID Alert New Jersey. And if it turns out that you get a call one day, and hopefully not, that you are positive for COVID-19, our staff in the offices in the health departments right across the state will, of course, call you and inform you and give you instructions as to what you should do because you're COVID positive. But you'll also be asked if you will agree to inform anonymously those with whom you've been in contact for more than 10 minutes within 6 feet, so that they can take steps to protect their health and the health of their loved ones and their co-workers. So this is, and again, I can't emphasize enough, this is an anonymous process. No one will be tracked. The government won't know where you've been. Those people who were informed will not know that they might have been exposed, will not know who it was that was positive. It's entirely anonymous. And so for those people who are concerned about that, and that's everybody, but particularly for those teenagers and 20-somethings that have, and we've seen this in the data, gone to a party perhaps they shouldn't have attended, somebody ends up positive, and then nobody wants to be involved in the process of contact tracing. This COVID Alert New Jersey will allow for anonymous contact tracing, and I urge everyone to download this program and use it. Those in Connecticut are doing the same. In Pennsylvania, they're doing the same. Delaware, they're doing the same. I downloaded it just last week, and I encourage everybody to do the same. Yes.
So it would basically be the honor system.
Well, the honor comes if is involved. If it turns out that you're positive, you will be asked if you will share your Bluetooth contact information. Now, you don't have to do that. It's a question, and then you'll take steps to share that information through a portal that the state of New Jersey establishes that will then make the alerts out to the phones and the applications on those phones of persons with whom you've been in contact. So it is it's an entirely anonymous process. It is voluntary. No one's tracking you. No one will know if you're the one who is positive, potentially expose them. All of that happens in the background. Your information is protected and secure. And just so that you know that say on day one I'm close to someone and we both have the information on the app. 14 days later, outside of the infection window, that information drops out of your phone. So you're only talking about potentially, if there's an issue, contacting someone who could present symptoms within 14 days of exposure. So it's very secure, it is safe, and it's anonymous to the users of it. And I think that's a very important message for everyone. Just a couple more points, given the time of year. We are approaching a flu season, and as has been pointed out, and people who've lived long enough will know that occasionally we get a flu pandemic, a seasonal flu pandemic that is really quite severe. Just a couple of years ago, we had people entering the hospital with flu, where because of capacity issues in the hospital, people were lined up in the hallways. They were being cared for in rooms that were not designed for patient care because of the overload of the hospital delivery system caused by flu pandemic. Now, if we get one of these flu pandemics this season, on top of what is expected to be resurgent coronavirus disease, we could really be in for a very rough go of it. And so I urge people to avail themselves of effective, safe influenza vaccine. If you've never gotten a flu vaccine before and you think it's malarkey, as Vice President Biden often says, this is not the day, this is not the season to throw caution to the wind. I really urge everyone, I can't really urge any stronger than saying it, you must get your flu shots this year. Let's make sure that let's take steps against the one virus we know that we can, whose effects on us as individuals and as a population we can reduce through a safe and effective means, that is the use of a vaccine. We don't have a vaccine yet for coronavirus, unfortunately, but you don't want to ever fight a two-front war. If I can do something about flu, I'm going to do it, and I will use the tried and true methods of wearing a mask and washing my hands, keeping socially distant, being careful about my own health and the health of those who are my friends and neighbors and coworkers by taking common sense measures. If we'd applied these measures at the earliest stage of this infection reaching our shores, we would not today see more than 200,000 deaths. We would not today see more than 7 million people affected with coronavirus. So it's a timely application of effective measures to push back against this scourge. We can, working together, do it. We're working together as a college, as an Office of Emergency Management, as a health department, as a county administration, as a state, as a federal government, working together to push back against this. And that needs to extend to every one of us living in a free society, to take up the simple, cheap arms against a very deadly virus. Together we can do it. So let's stay together and do so. And lastly, you see this sign over here about the census? The census, this census determines how federal dollars are spent, and I don't know who wisely put this here for you all to see. Thank you, Charlene. But let's remember to get those census forms filled out. If you haven't done so, it can mean a great deal for the ability to sustain the college, sustain important functions and human services and healthcare. Please fill out the census. And with that, if people have questions, I'd be happy to take them. Yes.